The second week of pregnancy, ovulation and fertilization. The second week of pregnancy is a pivotal time in the journey towards conception. During this week, your body undergoes crucial changes to prepare for the potential fertilization of an egg. Although you may not yet realize you are pregnant, understanding what happens during this week can provide insight into the early stages of pregnancy. The concept of gestational age. Pregnancy is typically measured from the first day of your last menstrual period, not from the actual day of conception. By this method, the second week of pregnancy is still before fertilization occurs. Healthcare providers use this gestational age system because it's difficult to pinpoint the exact day of conception, but most women know when their last period started. The menstrual cycle. A recap. The menstrual cycle, which averages 28 days, is divided into several phases. Menstrual phase, days 1 to 5, shedding of the uterine lining. Follicular phase, days 1 to 13, follicles in the ovaries mature, preparing for ovulation. Ovulation, day 14, release of a mature egg from the ovary. Luteal phase, days 15 to 28, the uterine lining thickens in preparation for a potential embryo. Ovulation, the main event. During the second week of pregnancy, your body is gearing up for ovulation, which typically occurs around day 14 of a 28-day cycle. Here's what happens. Hormonal surge. Estrogen levels peak, leading to a surge in luteinizing hormone. This surge triggers ovulation. Release of the egg. The mature egg is released from the dominant follicle in the ovary and enters the fallopian tube. Fertile window. The days leading up to and including ovulation, days 12 to 16, are considered the most fertile. Sperm can survive in the female reproductive tract for up to 5 days, increasing the chances of fertilization if intercourse occurs during this time. Signs of ovulation. Many women experience physical signs of ovulation, which can help identify their most fertile days. Changes in cervical mucus. It becomes clearer, thinner, and more stretchy, resembling egg whites, to facilitate sperm movement. Mild pelvic pain. Known as Mittelschmerz, some women feel a slight twinge or pain on one side of the lower abdomen. Increased libido. Hormonal changes can lead to a higher sex drive. Basal body temperature rise. After ovulation, a slight increase in basal body temperature can be observed. Fertilization. The beginning of conception. If sperm meets the egg in the fallopian tube during this fertile window, fertilization can occur. Here's what happens next. Sperm penetration. One sperm penetrates the egg's outer layer, initiating fertilization. Formation of a zygote. The genetic material from the sperm and egg combine to form a zygote, the earliest stage of an embryo. Cell division. The zygote begins dividing as it moves towards the uterus, a journey that takes about 5 to 6 days. Preparing for pregnancy. While it's still early, making healthy lifestyle choices during the second week can impact your chances of conception and overall pregnancy health. Nutrition. Maintain a balanced diet and take prenatal vitamins with folic acid to support fetal development. Avoid harmful substances. Continue to avoid alcohol, smoking, and recreational drugs. Limit caffeine and avoid certain medications. Exercise. Regular moderate exercise helps maintain a healthy weight and reduces stress. Monitor ovulation. Use ovulation predictor kits, OPKs, or track basal body temperature to identify your most fertile days. Emotional and mental preparation. The second week of pregnancy can be an emotionally charged time if you are actively trying to conceive. Managing stress and staying positive are important. Stress relief techniques such as yoga, meditation, and talking to a supportive partner or friend can be beneficial. Looking ahead. By the end of the second week, the groundwork for conception has been laid. If fertilization occurs, the zygote will continue its journey to the uterus for implantation. The early stages of pregnancy are critical for setting the stage for a healthy pregnancy and baby. Understanding what happens during the second week of pregnancy empowers you to make informed decisions and care for your body in ways that support conception and early pregnancy. As you move forward, stay proactive about your health and embrace the changes your body will undergo on this remarkable journey.